you told the story about your tooth and what you had to go through in order to restore that tooth. And you said that you had to sort of mourn that loss.
Yes, I did. It was very difficult.
Yeah.
And as a performer, I'm concerned about what my mouth, is feeling, and it's difficult if you're, in the public view and your mouth is being looked at, that you feel comfortable.
Right.
You must feel comfortable with what's going on in your, with your teeth.
Right.
So, it's important to me.
Okay. If you don't mind, the piece I didn't get of that story is how that all came to be. How you ended up having that tooth. You said it abscessed?
It was a simple toothache that turned into several x-rays, which they discovered the tooth had a crack.
Okay.
It was probably with a very old filling, very large old filling.
Okay.
Maybe had been in my mouth for maybe 30 years.
Okay.
And eventually the tooth did crack, and so two dentists actually did look at it very intensely, trying to discover whether the crack was completely through the entire tooth or just partially. So whether or not they'd be able to save my tooth or have to extract it. But they did decide that they could save it, and they did a very successful root canal, which was not even painful. It was actually very well done. Unfortunately, my follow-up to receive the crown was postponed. They rescheduled my appointment, and as a result, the delicate condition of my tooth actually caused it to crack all the way through. And so the final outcome was that I had to have the tooth pulled, which was really very traumatic to me.
Yeah, that's what
but I suppose for some people it might not be as big of a concern, but it was for me.
Well, clearly your teeth are important and you don't want to lose them.
And it was difficult adjusting to having that void in my mouth.
Right.
It was very hard. It took actually several months.
Okay.
But now I have to make a decision of what to do with this missing tooth.
And hopefully we can help you to do that.
That'd be great.
Yeah. When we spoke on the phone, I told you we would gather information, and really that's what we would like to do today. We may not come to a conclusion about how to treat it right now, but we will investigate with you and hope to come up with at least the information we need to.
That's wonderful. That would be very helpful.
Okay. Sandy, you said you had some larger fillings in your mouth, and I'm wondering what dentistry was like for you as a child.
Well, we did go to the family dentist, and he was very liked and well respected, and I went to him for years. I imagine fillings seemed a lot larger in those days, and that's what I've been told, but not having a dental background, I'm not really certain. However, I did actually end up switching dentists sometime in my late 20s because he did not sort of follow through with the new practices of being a lot more hygienic and did not wear gloves. So I felt it was time for me to find a new dentist.
Did you have a sense that there was actual decay there, or it was just the way that he prepared a filling?
I'm sure there was decay, but it seemed, oftentimes I remember him saying, it's just a pinhole, it's a very tiny, tiny, tiny little cavity. But, I mean, what did we know? You put your trust in the hands of the professional.
What is your trust level now in dentistry?
I'm a little cautious, but I find that, if I feel that they are respected and educated and dedicated to their craft, I usually am, calm enough to follow through with what needs to be done. So, I try to do a little bit of investigating to see who the dentist is and, what they're...
It sounds like you do lots of research before making a decision.
So I know. I mean,
That's
all you can really do is network a little and ask, for references and see what people think, other patients.
Can you hear the attitudes and beliefs Sandy has about dentistry and her health? Listen to the experiences she's had in dentistry and how she holds herself to those experiences. Her expectations, fears, and concerns help us to look at the level of trust she has in dentistry now. We can help Sandy to look at the control she has over her health. Her preferred outcome depends on it. When I hear you making the choice for dentistry, your choices for holistic healing, that feels really good. And I hope that you ask us as many questions as you need to find out about us before.
I'll try to, because I think it's important for the patient to be as informed as possible, as well as obviously the professional needs to know everything that he needs to know about the patient. So for me, it's helpful for me, because otherwise I think I'd be very scared.
Right.